Hi, my name is Rob Hendricks. I'm a trial attorney based out of Atlanta, Georgia. I specialize in workers' compensation and personal injury law. Over the past 10 years, I've handled thousands of cases. Through that experience, I've learned that the IME, or independent medical evaluation, can be one of the most crucial events in your case. If the facts are not in dispute, often the IME can be the determining factor in the outcome of your case.
Hi, my name is Dr. Scott Barber. I'm a board-certified sports medicine-trained orthopedic surgeon, and my goal today is to help you prepare for your upcoming independent medical exam, or IME. One of the things I'd like to tell you about preparing for an IME is don't exaggerate your symptoms. When you go to see your doctor, they're going to run you through a physical exam, and they're going to be able to pick up what's wrong with you. So be honest and let them know exactly how you're feeling. If you've had any treatments prior to seeing that doctor that have given you relief, be honest and let them know that that gave you. In this segment, we're going to talk about evaluation of the elbow. Now, most patients that come to see me for problems with their elbow have two major categories. One is what we call overuse syndromes, which would involve things like tennis elbow and tendonitis, or what we call cubital tunnel syndrome, which is pressure on a nerve at the elbow that leads to numbness at the small finger. We call that cubital tunnel syndrome. The second category of patients are those that have sustained a trauma to the elbow, where they actually have a broken bone or an injury to a ligament in the elbow. Whenever I examine somebody for elbow, the first thing I want to check is their range of motion. So I'll ask a patient to extend their elbow so they can see how far they can extend it, and then I'll ask them to bend their elbow and see how far they can flex it. And shoulders is evaluate the range of motion. So the first thing I would ask a patient to do is to raise their arms as high as they can. Now, typically what will happen is if somebody has an injury on the right shoulder, the left shoulder ought to work fine. So be sure that you act normally with the good shoulder. Finally, a very common injury that we see in workers' comp claims are an injury to a cartilage on the outer part of the wrist known as the triangular fibrocartilage complex. We typically refer to it as the TFCC. And patients will typically complain of pain on the outer portion of the wrist, on the small finger side of the wrist. And basically, if I press in that area, it'll elicit pain. Or if I take the hand and I try and grind the outer portion of the wrist against the outer portion of the hand against the wrist, it will elicit.
It is our aim that this video has armed you with the knowledge to be better prepared for your IME, as well as giving you an idea of what to expect and things to avoid so you can achieve the best result possible.